My name is Chelsea Stover, and I'm a program coordinator with the Wisconsin Women's Health Foundation and our perinatal programs. It's great to see some new faces in the group, and it's great to see familiar ones as well. So again, just thank you and welcome. We want to provide a high-level overview of our 2015 program results to help set the stage for the information that you're going to be hearing later on today. In 2015, nearly 1,300 pregnant women enrolled into First Breath. Of those, 83%, it's huge guys, 83% were able to make positive changes in their tobacco use. This past year was also quite exciting as we enrolled our 17,000th woman into the program. 18 new sites began implementing the program in 2015, some of which are here with us today, bringing our total number of First Breath sites up to 158, with over 960 providers trained. As we do every year, this past summer, we interviewed previous First Breath participants to receive feedback on their experience in the program. And what we heard from them was not a surprise. First Breath works. It makes a difference. And it's due to the positive impact that all of you have in their lives. The majority of responses indicated that their favorite part of the program was the support and information that they get from all of you, their providers. In addition, 90% stated that you all assisted them with making a plan, which we know is vital to behavior change success. Here is what participants are saying. These quotes continue to support the true impact that your relationships have on the participant success. So really, understand and acknowledge that you guys have a huge impact on these women's lives, and you are the reason that these programs have the success that they do. So give yourselves a pat on the back, or a hug, or whatever you want to do. Happy dance. All right, give everybody a chance to read through. Next, we collected feedback from all of you in our annual provider survey. And while we always appreciate your positive feedback about the program, your constructive criticisms and areas for improvement are really most beneficial for us to plan on program planning. Last year, 3 areas emerged as ways we can continue to make our programs more effective. These are information on e-cigarettes, also known as hookahs, vape pens, all that good stuff, additional training opportunities, and updated and new materials. So we are increasing our program effectiveness by creating these new materials for your use and offering new opportunities for continued education and training through both individualized and group settings. Our 2016 survey will be distributed this coming April, and we appreciate your consideration to provide feedback. Plus, we always give you guys like a $5 gift card, so why not? You guys are just as incentivized as our providers and patients, right? A few reminders for First Breath tools, and I want to thank Kayla, who has been working tirelessly on our webpage to get this up and going. We do encourage you guys, please continue to use our online data entry system. We apologize for the recent inconvenience of our foundation website being under construction. The data links were always active, but we know many people use the links on the old site to access the data entry portal. And a new page with links is up and running. So if you've been sitting on any old forms waiting for this to be live again, please be sure to enter them as soon as you're able, because online data entry does continue to be the best way to share that participant data with our team. Also, if you have yet to view our CME webinar on perinatal smoking cessation, challenges and opportunities, please do so. First Breath counseling tools are still available for order through the material order form. And as I previously mentioned, several of them, including the action plan and goal setting tools, will be touched on later this afternoon. And finally, our social support programs. In 2015, our Text Connect Quit program had some exciting updates, including a new number, which is 97779. If you need new promotional materials which reflect this update, please let our perinatal programs assistant, Lauren, know. 402 First Breath moms participated in TCQ in 2015, all of whom received motivating text messages 3 to 4 times a week at no cost. 25% of these women responded to the text and interacted with our staff members through additional comments or questions. You guys probably see this joke on the bottom. Can you guys read it? They're sitting at the dinner table, texting on their phones, and one of them says, "You have a piece of lettuce in your teeth." And the other says, "Thanks." I think it's funny in a couple different ways. I always get food stuck in my teeth, always. But I think you guys can kind of giggle at this too, because I'm sure you guys see participants that are, oh, yep, yep, right? So you're like, why would I encourage them to do more texting? They already do enough of it. But what we do know, although this is a little bit funny, is that texting does work. We have some preliminary findings, and what it is showing is that women who are involved in Text Connect Quit continue to have an impact. This continues to have an impact on their smoking status postpartum. So the data is showing when you encourage women to use Text Connect Quit, it does make a difference. So please continue to do so. We've made some changes in our Facebook page, and now before I talk about them, we need a raise of hands. How many of you are personally on Facebook? Awesome. All right, so our new and improved Facebook page is for you. It is an easy way for us to quickly share information about online resources, encouragement from other providers, quotes from participants, and more. The Facebook page is not just for First Breath participants. It's really for anyone who wants to be up to date on what's going on in the world of First Breath and prenatal smoking cessation. So feel free to take a minute to go online, open up your Facebook app, and like us. All right. The last tobacco-related update that we want to share is about our Striving to Quit program, which was a 5-year research grant from CMS investigating the impact of financial incentives on smoking cessation. Throughout the study, 1,052 First Breath moms enrolled into postpartum smoking cessation services with our health educators, some of which are here today. The services ended in December of 2015, and we're starting to see some preliminary results. Of the women who participated in the Striving to Quit program, 40% of them were not smoking 6 months postpartum. This was biochemically verified. In comparison, the typical quit rate for intensive smoking cessation for the general public is 28%, and the typical postpartum relapse rate is 70 to 85%. In 2016, we have several evaluation activities planned, and we'll be very excited to share the results with all of you in the fall. Although the Striving to Quit programming study is ending, we're excited to announce that we are building on the lessons learned to create what we are calling First Breath Families. First Breath Families follows the Striving to Quit model for postpartum smoking cessation support through home visits and also engages the participants' social support network. First Breath Families is not a research study. So far, we have received 2 grants allowing us to continue this important work in the following regions. Enrollment for the Community Opportunities Grant will end in May, and enrollment for the Dean St. Mary's Grant will continue through the end of 2016. We are also holding a small project in the southeast region of the state, and this enrollment period has closed. If you don't see a region as part of these services, please stay tuned. We have not forgotten about you. We are working very hard in seeking funding to expand to additional counties. First Breath Families does not require any additional work on your part. Simply continue to enroll women into First Breath, provide us with accurate contact information, and our health educators will connect with any women who may be eligible. If you do have any questions on First Breath Families, please feel free to speak with Chrissy Alanese, who is the program manager for these services. Oh, and there's also a handout in your binder on this information. I think behind the slides in the same section, you can find more information. All right, so now that we've discussed the impact from 2015, a few items to look forward to in 2016. If you're a site coordinator or have recently reviewed our monthly e-newsletter, you probably saw our announcement regarding our new monthly email notifications about enrollment reports and postpartum survey reminders. One challenge, as you guys could probably know, we have run into since the First Breath program began is that we have a large number of women who enroll, but for any number of reasons do not complete the program. On average, we do not receive postpartum information for 60 to 70% of the women who enroll in First Breath. To improve upon our data collection and analysis, one of our goals for 2016 is to reduce the number of participants who are lost to follow-up. So as part of our plan to address this, we thought it would be wise to follow up with providers and ensure that we have received all available information. So each month, we are planning to touch base on the status of your participants. We definitely understand that many of our participants may simply miss their postpartum appointments altogether, but if you would be able to just double check and ensure that all available information has been submitted, this would be extremely helpful. Postpartum data allows us to properly analyze the effectiveness of the First Breath program, as well as how it has benefited women and the health of their babies. Also, as you're planning for your summer and fall schedules, please keep in mind the new refresher training options that will be available to your staff. Building upon last year's regional practice session, we will be offering training on stress management and mindfulness for providers and participants. And this year, we're also highlighting the importance of moving through the change process. Does anyone have any questions about First Breath updates or First Breath families? All right. So now transitioning to My Baby and Me. Last year, as you know, the My Baby and Me program also saw some very exciting developments. If you're a current My Baby and Me provider, can you just raise your hand quick? I love seeing those hands go up. I always call My Baby and Me my baby. So, it's very exciting to see the growth that we've developed. We are close to completing 12 months in our new referral model, where you are providing a brief screening and consistent messaging about prenatal alcohol use, and then referring interested women to the Wisconsin Women's Health Foundation for phone-based support services. The response to this change in programming has been really overwhelming in a great way. Last year, over 900 women were screened for prenatal alcohol use, bringing us to over 2,200 women since the introduction of the initial screening in November of 2013. It's a lot of women just in the past couple years. Of the 933 women screened, 105 were referred to our Wisconsin Women's Health Foundation pregnancy educator, Rebecca. You guys met briefly. And all of those referred and successfully reached, 53 women were enrolled for additional support services. 96% of women screened received key messages, which continues to support that we all share the same goal of providing consistent, evidence-based core messages about alcohol use during pregnancy, especially in our great state of Wisconsin with the highest binge drinking rate of all women aged 18 to 44. And nearly 90% of women who are successfully reached are engaging with our pregnancy educator to assist in their efforts toward an alcohol-free pregnancy. 82% of enrollees successfully quit drinking or remained alcohol-free, and 18% were able to cut down. So 100% of the women were able to make a positive change. This really is truly outstanding and very cutting-edge work being done in the world of FASD prevention. So give yourselves a round of applause for that. Thirteen new sites began offering My Baby and Me in 2015, bringing the total number of sites to 82. In addition, just last year, 368 providers were trained in FASD prevention screening and intervention techniques through the My Baby and Me program trainings and online training module. We look forward to continue growth of these services in 2016. Last year, similarly to First Breath, we also conducted a My Baby and Me annual participant experience survey to see what participants thought about the new services. And when asked, what do you like most about the My Baby and Me program, these were some of their responses. Again, we noticed the importance of the support and impact of the provider and participant relationship with all of you, as well as our pregnancy educator. Give you guys a minute to look through those. Thank you to those of you who participated in our 2015 My Baby and Me Provider Survey. Your responses indicate that you feel the program is effective and you appreciate the new online training and improvements to program screenings. Your input is much appreciated and allows us to continue to improve upon our programming efforts. More information and data can be found in the My Baby and Me annual report, which is available at the resource table. And we'll be looking forward to your feedback again this coming summer. Finally, before I finish up and ask for questions, there's one more opportunity that we have for you. We are asking for your help connecting with nurses who may be interested in joining the Wisconsin Women's Health Foundation Grapevine Project. Are any Grapevine nurses here with us today? I know we do have some from First Breath and My Baby Me. All right. Any nurse who is passionate about prevention, health education, and grassroots public health is encouraged to get involved. If you have any questions, please feel free to contact Nora Miller or any of the Wisconsin Women's Health Foundation staff here today. There's also more information on this at the resource table in the back as well. So we're just getting started with our programming, and we are so again very thankful for your participation at our 11th annual perinatal program statewide meeting. All right, thank you guys.